I would like to describe our research regarding evaluations of tumor acidosis that monitors early response to radiotherapy in a GBM model using AcidoCEST MRI. I do not have any conflicts of interest to declare for this work. I'd like to describe AcidoCEST MRI, which uses a contrast agent that has a proton that exchanges with water. When we selectively saturate that proton and it exchanges with water, it appears that the saturation has been transferred to water and the water signal has decreased. That's seen in this experiment where we placed iopamidol in the inner tube and then selectively saturated a series of MR frequencies, and when we reach 5.6 ppm, the inner tube will go dark, and that is the CEST effect. When we saturate at 4.2 ppm, we also see the inner tube go dark because that is the resonance of the other exchangeable amide protons on this molecule. When we selectively saturate at 0 ppm, the entire system goes dark as expected, and then we like to collect a symmetrical spectrum so that we can perform CEST analyses more easily. We prefer the Bloch-McConnell equations for fitting CEST spectra. The iopamidol is pH dependent and a good candidate for AcidoCEST MRI because one proton loses its CEST effect as the pH increases, while the other proton increases its CEST effect as pH increases due to the differences in chemical exchange rates of these two protons. And this is related to pH. Again, we prefer the more sophisticated Bloch equations for analyses. We're studying glycolysis in tumor cells by watching the conversion of pyruvate to lactic acid, which then is secreted into the cell and causes extracellular acidosis, as validated by a variety of preclinical tumor studies that we've done over the years. So we performed a study to determine if AcidoCEST MRI can be used with brain cancer. Even though there is a compromised blood-brain barrier in GBM models, it still can reduce the amount of contrast agent taken up into the tumor. And we need a lot of agent, approximately 10 to 15 millimolar or more, to perform AcidoCEST MRI. We also wanted to determine if extracellular pH, known as PHE, is a biomarker for tumor response to radiotherapy. So we prepared a GL261 model that has luciferase so that we can watch early stage tumor growth with bioluminescence imaging, and then we can eventually switch over to MRI when we see enough brightness indicating that the tumor has reached a larger size. We do 20 gray of treatment that resulted in 100% responders. So we backed off to 10 gray so we could study both responders and non-responders. Also, untreated mice occasionally have necrosis. They occasionally have no necrosis. So you have so-called responders and non-responders in an untreated group as well. So if we were to look at the tumor growth, certainly those mice that responded to therapy had smaller tumors relative to untreated mice. In this data, we are including necrosis in the tumor volume measurement. And so the untreated mice that had necrosis also had large lesions overall. So we are seeing the effect of therapy just based on tumor size, especially by data point 4, or by time point 4. We also see a change in tumor pH by time point 4 as well. And that's in approximately 10 to 12 days after initiating the therapy. And that's because we can see that untreated mice that showed no necrosis or non-responders to the therapy had lower pH than those mice that had necrosis or were untreated or that responded to the therapy. And we can draw a threshold at pH 7.0 to divide those two groups. There is no correlation between extracellular pH and the tumor volume as seen in this graph. That's good because pH is an independent biomarker and not just directly related to tumor size. So in conclusion, we have shown that AcidoCEST MRI can be used to study brain tumor models. We can use a threshold of pH 7.0 to identify responders versus non-responders. And PHE is independent of tumor volume, so it is an independent biomarker. This technique can be used for other tumor models, other radiotherapies, and could even be combined with PET to do simultaneous PET MRI method imaging to observe two biomarkers of tumor growth and the response to radiotherapy. I'd like to thank our research group and our funding sources and our collaborators, and especially Dr. Michelle Zales, a postdoctoral fellow in our group who has championed this project. Thank you.